All right, it is 9 o'clock by my watch. The I would like to call the January 20th meeting of the Department of Cannabis Control's Cannabis Advisory Committee, Public Health and Community Impact Subcommittee to order. Moderator, can you please call the roll?
Certainly, and good morning. Before we get started, I would like to remind committee members and senior staff who are not speaking to please mute their microphones. If I detect background noise during the meeting, I will interject with a brief and friendly reminder or simply mute microphones. Today, to facilitate public comment for this meeting, we will be utilizing the raise hand feature. When the committee chair reaches a point in the agenda at which public comment is appropriate, public comment will be requested. At the chair's direction, we will begin taking public comment. Now I will call the roll. Committee members, please answer present when your name is called. Chair Mathey?
Present.
Member Woolsey?
I'm present, thank you.
Member Bauer? And Member Tupy?
Present.
We have 3 of 4, so a quorum is established. So Chair Mathey, the floor is yours. Thank you.
Fantastic. Thank you so much, moderator. So we'll move on to the second item on the agenda, which is to define the subcommittee's scope and to identify and prioritize topics for 2023. I want to begin with just some kind of reminders about the CAC, the advisory committee's mandate and the goals of this subcommittee generally, as we've been advised, and they're here on this slide. So I'll just read them out so everyone's on the same page. So the CAC's mandate is to advise DCC on the development of standards and regulations pursuant to Division 10 of the Professional Business and Profession Code, including best practices and guidelines that protect public health and safety while ensuring a regulated environment for commercial cannabis activity that does not impose such barriers so as to perpetuate rather than reduce and eliminate the illicit market for cannabis. And so our subcommittee will identify topics of interest for the 2023 meetings, including but not limited to topics including potency, packaging and labeling requirements, advertising and marketing requirements, and regulatory compliance. The subcommittee will also consider which of the identified topics should be prioritized as agenda topics during the 2023 meetings, and what specific elements of these topics will be considered in future meetings. Now, I want to remind both the subcommittee members and the members of the public who are attending that today's agenda is really about setting the purpose of the committee and the list of topics that we would like to address and perhaps the order in which we would like to address them. We will not be making any specific recommendations to DCC today, most likely, because that would go beyond the scope of what's in the agenda. So what we can do is we can at the end of this meeting, we'll make recommendations for topics for the agenda for the next meeting. And at that point, we could make specific recommendations on those topics. Now, also just to get the ball rolling and get us started, I would like to propose a purpose statement that as a way for us to get the ball rolling, we can react to that purpose statement and discuss it, modify it, change it, but just as a starting place to work with. So I'll read out something that I have drafted as a purpose statement, and then we can open it for discussion amongst the committee members and take it from there. So the purpose statement that I've drafted says, the goal of the Public Health and Community Impact Subcommittee is to provide recommendations to the California Department of Cannabis Control on regulatory, statutory, and administrative changes to protect the health and well-being of the California population and to reduce the risk of cannabis-related harms, especially among communities who may be disproportionately impacted, including youth, people with mental disorders, low-income populations, and racial and ethnic minoritized groups. So that's the statement. A couple of considerations are, one, in terms of authority. DCC makes regulations, they don't make statutory changes. So while DCC can perhaps advocate to make statutory changes, in general, in this subcommittee, we're thinking about regulations and standards. So just think about that in terms of the scope. And some health-related issues are also under the scope of the California Department of Public Health, not DCC. So in terms of thinking about the scope of this committee, we also have to think about the scope of what DCC has authority to do, and because we primarily want to recommend things that DCC has the authority to do. And the current purpose statement that I just read doesn't explicitly talk about ensuring the prosperity of the legal cannabis market, but of course, that is a goal of all aspects of the CAC, because if there is no thriving legal market, there is no relevant public health regulations. So with that, I will open it up for the other committee members to react and provide their thoughts.
Would it be possible for you to read that one more time?
Absolutely. Absolutely. I realize I just spoke a lot. Okay. So the draft purpose statement is, the goal of the Public Health and Community Impact Subcommittee is to provide recommendations to the California Department of Cannabis Control on regulatory, statutory, and administrative changes to protect the health and well-being of the California population and to reduce the risk of cannabis-related harms, especially among communities who may be disproportionately impacted, including youth, people with mental disorders, low-income populations, and racial and ethnic minoritized groups. Yes. Member Tupy.
So I'm supportive of it. The only language that I had a little bit of concern with was just the statutory component, since that is kind of outside our scope. So I think I would maybe propose eliminating just that component of it, but overall, I thought it was a good purpose statement.
Great, thank you, Member Tupy.
And Member Woolsey, I would agree with that.
Okay, great. So if we removed the mention of statutory recommendations, the statement would read as making recommendations to DCC on regulatory and administrative changes, and just avoiding the word statutory. It sounds like we would all be in agreement with that purpose statement. Is that correct?
That's yes for me.
Yes, for me as well.
Okay. Is there a motion to define this as our purpose statement?
Yeah, Member Woolsey, I'll move to accept that statement.
And I'll second that.
Thank you very much. So now I think we, before we can have a formal vote, we have to have a public comment on this motion.
So would we open up the public comment for agenda item number 2?
Well, actually, a point of clarification. So we need to open up for public comment at least once per agenda item, and this agenda item includes both drafting the purpose statement and prioritizing the topics. So am I correct that we as a committee have the choice to wait to open for public comment until we have also defined the topics, or do we need to open for public comment immediately prior to every vote?
I can clarify that. I would also, excuse me, I'm a little bit sick, but I would also ask our legal counsel to jump in with anything that they want to add. Under Bagley-Keene, you must open for public comment once per agenda item. You do not have to open after every motion. You can make this motion and leave it on the table while you continue to discuss topics of interest for the subcommittee, and then come and do public comment and take all of your votes at once if you would like to hear the public comment to inform those. You do have the option to take public comment more than once per agenda item, but the minimum requirement is that you take it once per agenda item. And then I see our legal counsel on video, so let me also ask Frida if there's anything else that you want to add.
Hi, yes, Frida Lane here, legal counsel. That is correct. You can have discussion and motions and table them so that you have multiple motions and then go out for public comment on those motions. And then those public comments will be heard before you take action on those motions.
Fantastic. Thank you very much for the clarification. Appreciate it. So in the interest of efficiency, I would recommend that we leave this motion on the table and move forward with our list of priority topics for this coming year, and then take it to public comment when we have both the purpose statement and our list of topics in hand, barring any objections from other members of the subcommittee.
That sounds like a good plan.
Great. Okay. Hearing no objections, we'll move on to the second half of this agenda item, which is to identify priority topics to address in 2023. I have quite a long list of ideas, which I would throw out, and then I would appreciate input and discussion from amongst all of us on additional topics and prioritization of those topics. So just to start off, the list that I currently have is intoxicating hemp-based products, especially in light of the recent hemp report that just came out. 2 would be lookalike products and products that are attractive to youth, particularly candy, breakfast cereals, and drinks. Issues around warning labels. 4 high potency products, particularly dosing and titration and consumer guidance around those. Youth access, number 5. Number 6, there's a range of specific health issues for which the scientific evidence has evolved, but regulations have perhaps not kept pace because the scientific evidence is evolving so quickly. And so there are 4 health-related topics that I think it would be really useful for us to get up to speed on, and perhaps have someone come in and speak on who is an expert in that particular topic to come speak and get us up to speed, so that we can then, in the most informed way, make recommendations for regulations. And so those health topics, and there may be others, are cannabis use during pregnancy. There's been more recent research that has come out on the health impacts of cannabis use during pregnancy. Psychosis, links between cannabis products and psychosis. Cannabis use disorder, and the growth in cannabis-related poisonings that we've seen across the state since legalization was introduced. So those are 4, and there may be others that the other committee members would recommend. Other items that were identified more generally, and I think we would want to hone, are general restrictions on advertising and marketing. Agricultural impacts, which came up in one of the written public comments submitted ahead of time. Enforcement or regulatory compliance, and then lastly, medicinal use of cannabis. And I want to note around medicinal use of cannabis that this is a topic that we can address in this subcommittee, but there's also a new subcommittee explicitly dedicated to medicinal use concerns, and so most topics related to medicinal use might be better heard there. So that's the list of topics that I have, and I welcome ideas for other topics, as well as recommendations on prioritization of those topics.
If I could ask a question, are those listed in any particular priority, or were you just kind of, that's a list of topics that you thought of?
That's a list of topics. I would say the ones that that I would prioritize first would probably be lookalike products, warning labels, and high potency products, and then kind of many options for and the specific health issues for which we would want scientific updates. So those would be the 1, 2, 3, 4 items that I would put at the top. But the rest of it,
the one that I would add to the top would be the enforcement and regulatory compliance. I think that really speaks to addressing the statewide problem of a healthy legal market for people to, go to. So I'd kind of prioritize that amongst, in addition to those 4. advertising and marketing, I think, is a complicated beast because of certain free speech elements that kind of go along to advertising. But I think it's an important topic because it does touch on either youth access or, if not access itself, normalization and acceptance. As far as youth, I think studies have shown that in states that have legalized, it becomes more normal for adults to want to use this and as um, a drug is what it is, just like alcohol or tobacco. And as that normalizes, you see more and more youth wanting to try it, and so trying to address those through advertising and marketing, I think is tangential. Not sure how to pronounce that, but I think you know what I mean. Um, to the lookalike products, I think that really is a more of a priority than the advertising itself, because that does obviously attract children. I think that's where some of the poisonings come from. People have products at home. Children think it's their normal Fruit Loops, and the children eat it, not understanding, what they're eating. So that's the one that I would add to that list. But I would agree with that list as far as rising to the top. Now, which order you put those 4 or 5 things is another beast.
Thank you, Member Woolsey. And I would say that I would just note that we can create an order, but we don't have to create an order. We can also just say these are our priority topics. But to the extent that we are excited about, in particular, earmarking one for the next meeting, that would be.
Okay.
Can I ask, can you just restate the top 4 that you had listed? I had lookalikes, warning labels, advertising, and what was the other one?
So the 4 that I have are lookalike products, warning labels, high potency products, and dosing and titration of high potency products, and the 4th was the 4th is really kind of a bucket of several. It's the specific health issues for which the scientific evidence has evolved and we want updates on. So pregnancy, psychosis, cannabis use disorder, and poisonings. And then the one that Member Woolsey added, which also I think complements lookalike products and warning labels and things, and high potency products, is enforcement and regulatory compliance.
Yeah, I'm supportive of all 5 of those items being kind of the priority. If I was to list them as kind of 1 through 5, I'm not sure that that's what we're looking to do exactly, but I definitely, based on public comment, think that the high potency and kind of regulations around that and the warning labels piece seems like that was specifically asked for by a number of folks in comment. And I agree with Member Woolsey about the enforcement and regulatory compliance component as well. So yeah, I'm supportive of those. I'm supportive of the entire list that you gave, but those 4 or 5 being the priority, I definitely am supportive of that.
That's great.
I do have a question for you on the science. I know a couple of years ago, there was a lot of problems with some vaping products that got out and caused some very specific lung diseases. And I'm curious if there's been scientific research on what is an acceptable vaping additive. That might be something that if we could invite someone to talk to those in addition to your other list of 4 science-related health topics. I don't know how those would relate to recommendations for CAC, but definitely having an informed discussion would help.
That's great. Yeah, I'm very supportive of adding that as a specific health issue for which we would like an update. And I also saw that was mentioned in one of the written public comments submitted ahead of time, was a desire for more clarification and consumer guidance on different types of vaping products and the safety of those. I can add that to the list of specific health issues.
Yeah, I would appreciate that thinking.
Great.
Then, of course, listening to whatever the public might have to add to that list.
All right. So it sounds like we have a kind of consensus among ourselves about the purpose statement and our list of priorities at this point. Would you like me to read them one more time, the high priority items and the ordering of them before we open for, oh, we should make a motion. We would want to make a motion on the priorities probably. But would you like me to read them one more time?
If you could, that would be great.
Great. All right, and so now, right now I have these in order of, in a somewhat prioritized order, and we can adjust it, but let's say this is the candidate ordering. High potency products, dosing and titration of those. 2, warning labels. 3, lookalike products. 4, specific health issues for which the scientific evidence has evolved, but regulations have not kept pace, which includes 5 sub-items: poisonings, cannabis use disorder, pregnancy, psychosis, and vaping-related harms and additives. And then the last priority, number 5, is enforcement and regulatory compliance.
I would make a motion to have that list in that order be our priority. But if there's further discussion that's needed on that, I'm open, but that would be my motion at this point.
Hi, this is Amber Bauer. I'm not sure if this is the right subcommittee or not, but I did mention it to the chair. We are very concerned as we represent workers around the health and safety impact, whether it be pesticide use on the workers, repetitive injury with trimming, etc., and obviously the Cal OSHA 30 requirement enforcement. So we don't need to add it into the priorities if the group feels like it's inappropriate, but I do want to mention that there is a clear impact on the workers. And so I'm not sure if it makes sense to add here, but I would be remiss if I didn't say something in the discussion of the scope.
Thank you very much, Member Bauer, and welcome to the discussion. We appreciate the input. My inclination would be to include worker safety as a list that an item in our kind of secondary topics that we would like to get to in 2023 if we have time, but not one of the very first 5 that we have now identified. And I would welcome comments from members Tupi, and we'll see for their reactions as well.
Yeah, I would agree with that. There are regulations in place regarding pesticide use and probably repetitive work injuries. I know OSHA does cover the other, and there are also federal laws with how pesticides have to be used. And I think the general regulations require compliance with all laws. You don't have to just comply with the regulations that DCC puts forth. You have to comply with those other laws as well. So I think that's a very good topic, especially when it comes to educating businesses who are using these products, cultivators, and so on. So if there's an education component, making sure that they understand what those federal laws are and how they apply and how they can be used, or how they must be used, that's a great topic to add. I would kind of agree that it's not probably one of those top 5 for me, but it is definitely important to discuss that.
I would concur with what Member Woolsey said. I think it is important. I think these other ones, because there is other regulations, Department of Pesticide and things involved in the worker safety and OSHA, that our impact on that topic is probably, as a committee, is probably less than our impact could be on these other topics. So that's part of my reasoning to move that down the list slightly to these other topics.
Thank you very much. At this point, do we have a motion for the list of priority topics for 2023?
I did hear a motion, and while I'm happy to second it, I'm a bit reluctant to perhaps second it before hearing public comment in case there's something that comes up. Then we have to do amended motions if something that the public flags for us actually makes sense to add to that list. That's my only
Mhm.
concern with seconding that motion now before public comment.
That makes sense. That makes sense. So we can hear public comment on the content of everything we've discussed, and then we can make revisions and then have our motions go through, and then proceed with motions and votes and have that be the end of agenda item 2, correct? That was a question for DCC, sorry.
That is correct. Yes, thank you.
Perfect. Okay. So at this point, I would like to open it for public comment.
Thank you. We are now taking public comment on agenda item number 2 only. If you would like to make a comment on agenda item number 2, please raise your hand by clicking on the hand icon next to your name if you logged onto the meeting, or by pressing *3 if you called into the meeting. We are displaying instructions for your convenience. Please note that for the sake of time, you will have 2 minutes to speak with a 30-second warning. When your time is up, you will be muted and we will move on to the next request for comment. Each member of the public will have one opportunity on. So we can kick this off agenda item with attendee Byram. There you go.
We are seeing illicit delivery services delivering to our youth. And the ABC, when COVID started and deliveries of alcohol were happening, 80%, we saw an 80% failure rate. ABC started doing decoy operations, and it's down to close to single digits now. But in California, no one is doing decoy operations on these businesses. Our parents are, up in arms about, these individuals delivering to their kids in their houses. When is the cannabis control folks gonna do some enforcement on this? We've been waiting a long time. Thank you.
Thank you, sir. Attendee Gordon, I've sent you a request to unmute. There you go. Actually, I'm sorry, attendee Mardad, you are unmuted.
Yes, thank you. So I just wanted to echo what has been discussed about this vaping safety and scientific base safety of it, especially the recent report that is published in Journal of Medical Toxicology in December about this issues with THCO in vaping product that is possible causing injury epidemic in vaping product. I just wanted to highlight, and if it's possible to include more emphasis on THCO contamination in vaping products. Thank you.
Thank you. Now, attendee Gordon, I've sent you a request to unmute. There you go.
Thank you for the priorities that you have set so far that, with warning labels. I'm wondering if you could also include child resistance caps on all products. I think with the growth of the cannabis products, the packaging that are appealing child-friendly ways, and the incidence of childhood exposure to addictive products in the home are becoming so popular. We've seen such an increase in children going to the hospital, especially Rady Children's Hospital in San Diego. I think we have lax or non-existent regulations on these products, making it far too easy for our children to get their hands on these products. And I think babies and young children are the most vulnerable to the collateral damage with these products, not only through neglect or secondhand exposure, increased risk of further addiction, all through unintentional ingestion. I guess policymakers, they should be required to enhance child safety packaging for all of our children. And I thank you very much for letting me speak.
Thank you. Attendee Esmeralda, I've sent you a request to unmute. Attendee Diana Esmeralda, just sent you another request to unmute. All right, we'll move on to attendee Eberstein. Sent you a request to unmute. There you go.
My name's Joe Eberstein with the San Diego County Marijuana Prevention Initiative. If I had a wish list, my first one would be child-resistant packaging that protect youth from edible products, specifically colorful gummy candies. In San Diego County, we've seen a 75% increase in poison control calls since 2016. Many of these are children under the age of 3. My second would be drafting language on warning labels regarding drug interactions, utilizing the website drugs.com as a resource. Many people are unaware of the over 500 interactions with over-the-counter prescription medications and THC and CBD. My third is supporting compliance checks around minor access that work with local law enforcement and community groups. And then my fourth would be supporting regulations regarding these hemp-derived synthesized products that are really giving the legal market a black eye. I know the CDC and the FDA have put out public health alerts about these, and there are some dangerous side effects with some of these synthesized hemp-derived products. Thank you.
Thank you, sir. Attendee Sarash just sent a request to unmute. There you go.
Members, thank you for this opportunity to speak. My name is R.S. Jason Sarush, and I'm a policy researcher at the Public Health Institute. I just want to comment in support of the purpose statement and these priority topics for this subcommittee. Thank you so much.
Thank you very much. Attendee Mitchell Colbert, I've sent a request to unmute. There you go.
Real quick, I'm hearing a lot of talk about the science behind the potential link between cannabis and mental disorders like schizophrenia. I believe that was brought up. Last I heard, that is just a correlation, not a causatory link. So if you're going to look up that correlatory link, my question is, please also look up the correlation between drowning deaths and ice cream. Every summer, people eat more ice cream and drown. Don't know why that is. Correlation is not causation. So I really encourage you, if you're going to pursue that, only pursue causatory research, not correlatory research. When you're talking about vape products, not just when it comes to the vitamin E acetate epidemic of illegal products, that's what happened with E-Valley. It's mostly vitamin E acetate. We're pretty clear on what that was. But for any vape product, you should test the excipitants. The excipitants is the vapor coming out, not the oil going in, because every expert will tell you people don't eat the oil, they vape the oil. And chemical changes happen during the process of vaporization. So you should test vape products at the vapor end, not the oil end. All right, when we're talking about lookalikes, no legal cannabis product can package itself to look like a real product. That's very clear in the regs. So anything that is illegal. When discussing lookalikes, you shouldn't just focus on illegal market products that rip off food products, but also illegal market vape products that masquerade as legal vape products. That's a huge issue that could open up people to E-Valley and all kinds of other risks that we regulate in the legal market that aren't regulated in the unregulated market.
30 seconds.
On the topic of increased poison control calls, that is almost entirely up to parental responsibility. My parents had cannabis and a handgun when I was growing up. I knew where they were. I knew they were not for me. You cannot regulate good parenting, but you can try to educate them though. Finally, please allow all warning labels to be displayed via QR code. By having a required amount of warning labels and a required size of text, you are requiring a minimum size package for products. Because of all the warning labels, a single joint has to be in a huge package. Thank you.
Attendee KC, I've sent you a request to unmute. There you go.
For more than 5 years now, the state has been permitting marijuana commercial activities, including delivery services, marijuana that can be purchased online or on the phone and delivered straight to your doorstep. But the DCC nor local law enforcement are checking these delivery services to ensure that they're not delivering to a minor. For many years, the public, elected officials we sent letters, emails, made public comment asking the BCC, now the DCC, to conduct compliance checks on delivery services to ensure that they are checking the ID at every time they deliver a product. The state's ABC department, as was mentioned previously, for the past 2.5 years have been doing compliance checks on delivery services for alcohol to make sure that it's not delivered to minors. The first time they did these compliance checks, 80% of the time, alcohol was delivered to a minor. After consistent compliance checks, the sell rate to minors is now around 20%. They have made a significant positive change in protecting public health by reducing access to minors. Why is the DCC not doing the same thing? One state department, the ABC, is taking seriously the prevention of youth access. The DCC for marijuana is not. We would ask that this subcommittee work to ensure that we have proper guardrails in place so that our youth can't access marijuana from a delivery service, like doing compliance checks. We have marijuana products that are flavored and very attractive and appealing to youth. We have marijuana products that are very potent and very harmful to developing young brains. Reducing youth access to these potent and appealing products must be a top priority. It is our hope that this year these compliant checks on delivery services can start to ensure that our youth are not accessing marijuana from a delivery service and that the delivery service drivers and their vehicles are adhering to the many regulations put in place by the DCC. Thank you so much for your time and consideration.
Thank you. Call-in user number 12. I've just sent you a request to unmute. Call-in user number 12. I sent you another request. There you go.
Good morning, committee. We're really appreciative parents are. I'm calling in on behalf of Coastal Community PTA. We very much like the list that you've put forward. Just a couple of other things that concern the parent community. One is the way that DCC describes what sensitive uses are and neglects to add churches, libraries, and playgrounds. We feel this is really disrespectful to youth, children, and their families to have marijuana businesses just next to where they often and their families like to participate in.
Ooh, call-in user number 12. There you go.
Sorry. We're just concerned that our children be more respected in the locations where they tend to play and go to read and to participate in their faith are not considered sensitive uses and need to be. And the other concern of the parent community is the advertising that we see, large billboards hanging over our freeways that we drive up and down with our children that make marijuana look like it's some sort of relief from the stresses of the world. This is a very inappropriate message at this time in the lives of our children. Thank you.
Thank you. Attendee Erica Leary, I've just sent you a request to unmute.
Thank you, committee members. I really appreciate the conversation this morning and support your goals for the committee and the discussions on public health. I would just like to reiterate some of the comments previously made about making youth access a priority. It is a proven public health strategy. We've seen the success in curbing alcohol and tobacco sales to minors, and those similar efforts are not being seen yet in the cannabis industry. There's models to replicate, funding available like they do through ABC grants, and I think that should be a priority to protect public health and youth access. Thank you.
Thank you. Attendee Geringer, I've just sent you a request to unmute.
Yeah, Dale Geringer on behalf of the California National Organization for Reform of Marijuana Laws. And on behalf of the consumers of California, we really welcome this committee's efforts here. We think it's important to take a look at the issues that are raised by this wide variety of new products that consumers are facing and don't necessarily understand that well. And in particular, there's a lot of new, very high potency products that are out there that need to be addressed. We urge you to prioritize consumer education and information on safe use in this area, and particular to seek some input from knowledgeable medicinal cannabis physicians, patients, and consumer advocates. We submitted some extensive written testimony on this, but let me just point out briefly that the DCC currently does offer a certain amount of consumer information on its website under links for responsible cannabis use and medicinal cannabis, but neither of these links are really all that helpful or complete. I won't go into the details of everything, but I would particularly point out, for example, the page on responsible cannabis use says we do not fully understand the health effects of vaping or smoking cannabis, and sort of leaves it at that. And in fact, we do know an awful lot about vaping and smoking, although we know, in fact, that vaping can be a really valuable smoke harm reduction tool if properly done. We also know that it can be dangerous if the vape products are contaminated or have harmful toxins in it. And as you may know, we recently issued a health warning about the THCO acetate issue, although that's THCO acetate is supposedly illegal in California. We are working right now on compiling more information about vaporization and would be happy to share our expertise with you on that at a later date. I'll skip over all of the other issues which are in our written testimony. I would say that—
Thank you, your time is up. Attendee Cedar, Joanna Cedar, I have sent you a request to unmute.
Me?
I can hear you, yes.
Great, thank you. I would prioritize at the top of the list intoxicating hemp-derived cannabinoid products that threaten the legal market. These products have no age gating, they have no child-resistant packaging, they have no potency caps, they are not required to be tested, are not in track and trace, they can resemble candy and snack foods, and can usurp the marks of traditional CPG goods. They are not sold in licensed dispensaries. I hear people talking about delivery services. How does one control the United States Postal Service? Because that's where these products are coming from. And specifically with related to the vaping of THCO, I'm glad that somebody mentioned that. It's vitally important to recognize that these products are coming exclusively from the hemp-derived market. Also related to this issue, please address and direct poison control to properly define products and where they are coming from by asking them to take pictures of the products so that we can differentiate between that which is coming from the legal market and is a parenting issue and that which is coming from the intoxicating hemp-derived cannabinoid issue. And because these products are available in convenience stores, through the Postal Service, in gas stations. And so somebody mentioned earlier, I think the gentleman was from San Diego, about that this is leaving a black mark on the cannabis industry. It is. Please address it. The hemp report was not sufficient in creating a plan to move intoxicating cannabinoids regardless of source, into the market. Thank you.
Attendee Lily, I have sent you a request to unmute. There we go.
saying a lot of the commenters worried about children getting access to products that are not in child resistant packaging. None of that is on the regulated side. Like on the regulated side, we have to child resistant package everything from flour to topical. So I would really not want us to have more regulations around packaging and warnings that are in reaction to what the unregulated market is doing, because it feels a little unfair that we are the ones who are getting hit by more regulations as a reaction to what the people not following any of the regulations, what they are doing. But yeah, on the regulated side, children are accessing products or copycat products or any of these other things that have been brought up. They're not a thing on the regulated side. Thank you.
Thank you. All right, Diana Esmeralda, I've sent you a request to unmute. Yay.
Hi, can you hear me?
I sure can. Thank you.
Excellent. I don't know if this is going to be under the correct agenda item, but I'm calling in about the regulated environment and how it imposes barriers to perpetuate rather than reduce and eliminate the illicit market for cannabis. So that's where the thing that I wanted to speak on right now. Because I am a victim of public corruption, and so is Tim Graston. We applied for a cannabis dispensary in the city of Adelanto, and two of the members.
Christina's asking me to jump in. Hi, this is a reminder that this public comment period is for this agenda item to define the subcommittee scope and identification and prioritization of topics for the subcommittee.
I believe that this would be a topic that there, not only me, but several people more all over the state are suffering from this. So we're lumped into something other than regulation. We can't participate in the market even. So when I'm talking about this, I guess I am talking on the wrong subject. Is there going to be a subject, a time for public speaking on
30
this subject in this meeting, or do I have to go back to the BCC again?
We'll do it at the end this time. Yeah, so there is a public comment period for items not on the agenda, and that will be agenda item 4.
Okay, thank you.
Okay. Attendee Zoe Schreibner, I've sent you a request to unmute. Oh, she jumped off actually. So we're going to send a Michaela Sweet, sending you a request to unmute.
Hello, I would like to see this committee include a focus on distinguishing between the regulated cannabis market and the illicit and illegal market, including manufacturers, distributors, delivery services, and retail channels when considering its public health recommendations to the DCC. This includes reviewing scientific studies on what we keep hearing increased visits to the emergency room and identifying exactly where these poisonings came from. It's not a solution to continue adding regulations to packaging and child-proof packaging and labeling to cannabis businesses that are licensed and complying with all laws and regulations while not addressing the extensive illicit hemp and cannabis manufacturers, delivery services, and retailers where you can buy these products in local convenience stores. Those are not legal products. My second point is Cal-OSHA is handled by Cal-OSHA, and they conduct workplace inspections and do visit compliance businesses. Adding regulatory recommendation or oversight by the DCC is duplicative and unnecessary. Finally, the hemp report published by the DCC did not meet the requirement of AB 45. The DCC did not outline the steps necessary to allow for the incorporation of hemp cannabinoids into the cannabis supply chain. The DCC needs to go back and review that report because it just did not meet the requirement of AB 45. Thank you.
Thank you. Attendee Mendelson, I've sent you a request to unmute. There you go.
Okay, great. Hi, my name is Lauren Mendelson. I'm an attorney representing various cannabis businesses throughout the state. And I think this is the appropriate subcommittee for this, given that the focus includes public health and also public safety. And that is, I would like to see a commitment from the DCC, or at least a conversation about addressing the robberies and break-ins at cannabis facilities. This is not something that's unique to the cannabis industry. However, given the value of the products and the fact that many of these businesses are operating with a lot of cash on hand, they're targeted in a unique way. And this is something that the industry itself is trying to work with and find solutions to, and has been trying to work with local law enforcement to address this. But it would be really great to see the DCC also kind of come out with some strategies and guidance, and maybe using some of the tax dollars that these businesses are paying towards finding a solution that protects the businesses, the customers, the staff. I really do think this is related to public safety. That's my comment, and thank you very much for having this meeting.
Thank you. I'd like to reiterate that public comment right now is on the topic of defining the subcommittee's scope and identification and prioritization of the topics for subcommittee focus in 2023. There was discussion earlier on that, and that's what these comments are for. So just wanted to reiterate that. I'm going to send attendee Schreibner a request to unmute. There you go.
I work with a retailer and supply chain distribution and manufacturer here in the state. And I just want to reinforce that as a compliant operator, we welcome enforcement for the health of not only the public, but also the industry. As compliant operators are dedicated to advancing public health, as well as ensuring that all the rules are followed. And I also agree with the point of ensuring that alongside enforcement of bad actors or non-compliant operators, now we also put a focus on intoxicating hemp-derived cannabinoids enforcement, as it is the greatest means to address copycat products. Thank you for your attention to this, and I support the 5 topics.
Thank you. Attendee Adrian Keys, I've sent you a request to unmute.
I would like to make a couple of comments. First off, I'd like to really support a lot about what Joanna Cedar said about the unregulated hemp-derived cannabinoid industry. Everything she said is absolutely accurate. It is one of the main sources of cannabinoid in the illicit market in across the country, in California and across the country. There is no age gating. You can buy them in corner stores across the state with if you got the money, you can get them. I would also like to make note specifically for the subcommittee's sake that cannabis products, although through breeding and advanced cultivation techniques, some cannabis flower has increased in potency. There are strict packaging requirements for dosages. You cannot have more than 10 milligrams of THC in a single edible product. You cannot have more than 100 grams or milligrams, my mistake, 100 milligrams of cannabinoid in a package, except in the medical component where you would need to have your card and all of that. Then you can get up to 1,000. So although flower may become more potent over time, we have existing guardrails in place for the potency of individual products like edibles. And many of these products, in fact, I believe all of them, are so well packaged in child-proof, child-resistant packaging that many medical patients, especially senior citizens who are using topicals, or edibles as medical products, are unable to even open the products on their own. So I don't believe we need any more regulation on packaging, labeling, etc. We need to see a broad crackdown on the availability of illicit hemp-derived cannabinoids. Thank you.
Thank you. Attendee Sexton, just sent you a request to unmute.
Doctor, I work at UCSD, and we have the only cannabis clinic in the UC system. So I see patients on referral for medical cannabis use. I don't have any commercial interests. I've just long been a patient advocate, and I think you have a great start on some agenda items for the committee. I just wanted to add maybe thinking about taking a look at the medical advice that's being given out by the dispensary personnel, because this is a real problem for especially older people who don't have a lot of knowledge of cannabis or any age really, and they go into a dispensary and are handed advice by very young people who don't have medical knowledge. And so we've had multiple cases, you know, where people are getting doses that are not considered therapeutic dosing, and intoxication that, you know, is disturbing for them, risking falls, et cetera, et cetera. So I don't know if this is the appropriate committee or maybe the medical committee, but I think it's something that needs to be looked at a little more closely.
Thank you. Sherry Yaffe, just sent you a request to unmute.
Making those comments. Those were excellent. So I'm also a physician in the Los Angeles area, and there's a couple other things that I'd like to add to this group's focus, which is that we do need a direct attention to the medical needs of patients. This oftentimes includes pediatric patients as well as seniors who have caregivers providing for them. This is of utmost importance as I'm dealing with patients who need to get legal involvement and costs thousands of dollars to get medication to be given at school, which is unbelievable for most patients and parents and children who need this desperately. Number one. Number two, the cost for patients. I know this comes up over and over again, but there is no longer any real cost savings nor addressing for patients. And this is a monthly cost that is completely out of pocket, both from a health practitioner perspective as well as a medication perspective. Also, protections for patients. We are seeing that slowly ebb into the legal arena, but not quickly enough for most patients. And again, where this comes into play at nursing home facilities where we are technically not allowed to prescribe. This comes in terms of schooling. This comes in terms of assisted living facilities. So there's a lot of others that are really getting benefit, and we're seeing the medical education and the scientific community providing us with all of this education, but there is no actual support for medical education. We've been talking a lot about public health education, but really the source for public health education has always been through the medical community. You go to your pediatrician, you go to your geriatrician, you go to your doctor to seek medical advice, but if those practitioners are not well educated, then we continue to have this really negative cycle. So looking for support for medical education is of utmost importance. I had another psychiatrist and physician also call me a quack, but as we've all noticed here in the discussion today, this is something where we need to continue educating physicians as much as everybody else.
Your time has run out. Thank you. Next, we have attendee Baum. There you go.
I'm Mary Baum. I'm with Say San Diego. I'm Director of Alcohol, Tobacco, and Other Drug Prevention, and I'm really encouraged by your list of topics. I did want to highlight that we conduct assessments of the permitted cannabis retailers in San Diego every April and October, and we find 80% of them have compliance issues. So we're really happy that you're going to be looking at compliance. And these include people loitering outside, young people loitering outside in some of these locations, lighting up in the parking lot, and a lot of signage and advertising issues. So we really are happy that you're going to be looking at compliance of the permitted retailers. I also wanted to highlight that we do additional assessments of smoke shops and liquor stores and markets. And we do see a lot of hemp-derived products being advertised across the street from high school. So I'm really happy to see that on the list. And just want to thank you for this comprehensive list. Thank you. Just wanted to give you a little update on what we're doing.
Thank you. Attendee Pamela Epstein, I have sent you a request to unmute. Attendee Epstein? Attendee Pamela Epstein. Nope, there you go.
Good morning. Thank you for the opportunity to comment. My name is Pamela Epstein. I am the Chief Legal Officer for Eden Enterprises. We operate both in the cannabis and the hemp space. I also am privileged to serve as the California Cannabis Industry Association's board president. I'd like to echo the other sentiments on the call regarding the intoxicating hemp-derived cannabinoids. In the state, in the country, we do not have uninformed consumers. We have misinformed consumers. It's important to note that cannabinoids, regardless of their source, affect the body the same way. I would like to share with this group, and we'll send around, CCIA's white paper on the topic of intoxicating hemp-derived cannabinoids. We seek the CAC to support the recommendation to build a bridge to get these products into the regulated supply chain where they can be tested, where they can be taxed, where consumers know that they are safe. It is important that we redirect this conversation. I've heard a lot about education. It's education in a multifaceted approach. It is educating the consumer on the differences. It is educating poison control and emergency room physicians that if it is intoxicating hemp, that it is not tested for residual solvents. It's not tested on the most part for heavy metals, and these products can harm the consumer. They can harm youth and they can harm unsuspecting consumers. So if we can invest in that process and help to make recommendations on how the regulated supply chain will be able to support and separate these products for the betterment of all, that would be a great appreciation. And thank you for your time.
Thank you. At this time, Madam Chair, I see no further requests for comment. Would you like a public comment on agenda item number 2?
Yes, please. Thank you.
Great. The public comment for agenda item 2 is now closed.
Fantastic. So I'd like to thank the public for all of these helpful and thoughtful comments. I want to say that we hear you. And there's a lot of work to be done. There's a huge amount of work to be done. So just looking through the list of items that came through in the public comment, many of them are in support of our existing list of priorities. And sorry, could you repeat that? Okay, I'm going to continue. Can everyone hear me?
Yeah, I can hear you just fine.
Okay.
Yeah,
Thank
sorry
you.
about that. I think one of our
Agenda
team
item
members
number
is
3.
having audio issues, and so it's cutting back in from earlier. So please continue.
Okay. So so
And now
much of it
closed.
was we are allowed to continue to discuss agenda item 2 before, correct? I just heard that
Yes.
agenda item. Okay, thank you. Okay.
Yeah, sorry about that.
Okay. So as I was saying, much of what was raised in public comment is in support of the items that are already at the top of our agenda. And in many cases, it was just providing more specific details of considerations that we should be looking into. For example, around warning labels or around the evidence on vaping. And so that's great to hear. There are a couple of items that came up repeatedly that are not currently on our list that I think we should talk a little bit about. The big categories here are youth access, especially compliance checks on youth access. That's not currently on our list of priorities, but it came up as one of the most frequently mentioned topics during this public comment period. Warning labels and consumer information also came up, one of the most frequently mentioned topics, and it's one that we have kind of mentioned and tabled, but maybe we want to raise higher on our list based on the number of public comments. Intoxicating hemp-derived products is also not on our list of top priorities at this point. I hesitate on that one because I'm concerned about what DCC can do at this point, because I think what is needed, and I welcome comments from the other members here, is hemp-derived products is really at the stage of making statutory decisions. And until there is a framework around which DCC can develop regulations, that hemp-derived products might not be under DCC's control. And so I think we should discuss that further, because clearly hemp-derived products are a huge source of public health concern and an urgent source of public health concern. So we should discuss that. And then the last thing I want to note is that many of the items that were raised under public comment fall under regulatory compliance. So things like youth access, illegal retailers, illegal products as being the source of lookalike products, child poisonings, vaping injuries. And so I'm wondering if maybe we want to raise regulatory compliance higher on our list and have under that list some of these subcategories of concerns like lookalike products be investigated under that category. So now I'd welcome comments from the other members.
This is Member Woolsey. I have a couple of notes that on the public comments that were made, and I appreciate the public support for the 5 that we've already identified. I think to the hemp-derived products, it's definitely an important conversation, but it's an extremely complex one. And until the DCC has been mandated to actually oversee how hemp-derived products would be brought into the cannabis supply chain, I think that's a topic that's probably not as appropriate for this subcommittee's focus. If the DCC does eventually take it up, then absolutely. And it could also be a broader comment for maybe the committee at large, but maybe not for this specific subcommittee. That's my opinion on the hemp-derived products. There were a lot of comments on labels and compliance checks and illicit market type activity. And I think that's all part of the enforcement component that we're already looking into. The thing about enforcement is you have to enforce both sides, and I think it's not necessarily a popular opinion, but we need to enforce against the illicit market in order to provide a healthy licit market. But at the same time, you have to have enforcement of the compliant operators to find the non-compliant yet legal operators who have a license, and that in order for that license to mean something for the public, there has to be enforcement on both sides, administrative compliance enforcement for both the illegal market, and the legal market. And I think a priority for the DCC can include both of those types of enforcement. And I was reminded as people were speaking that there are already regulations in place regarding labeling and packaging. Child resistant packaging is already a requirement. And, having a dispensary provide a consumer with a child-resistant package and then the consumer taking it home and through neglect or on purpose or otherwise not maintaining the product in that child-resistant packaging is an issue beyond the scope of the retailer or the manufacturer or the distributor. It was mentioned that it's a parenting issue when it comes into the hands of children, and to a degree it is. If you provide them the tool of a child-safe package and they don't use it, that's beyond the scope. So I think some of the issues are already kind of addressed in the regulations, and we don't necessarily need to add more regulations on top of them. As people were talking, I was kind of looking up some of these regulations to see if the comments that people were making were already included in regulations, and many of them were in regard to that particular topic. And also, one of the issues that I have is my eyes age. I find more and more product packaging that has really fine print, and the more you try to squeeze on a tiny label, the harder it is for people to read, and the harder it is for people to read, they just won't read it. So we have to be very mindful of the space of the information that's put on an otherwise limited space in the packaging. Someone had mentioned a QR code, which I think is great if people take the time to actually scan the QR code, which I'm guessing many people won't, but if you provide the information, then it's up to other people to determine whether or not they want to use the information. So all of that said, I think that I'm happy with the 5 item list that we have prioritized, and including as a part of the conversation and enforcement, many of the things that people talked about. I think that that's included in our list. And I have to remind myself too that this is just a list of priorities, not the conversation about each of these priorities. Those conversations will happen at a later date, and those are all very, very important things to discuss when we get to that date. So with that said, I don't know if the motion that was previously made to accept these 5 priorities, if it's appropriate to second it now, or if it needs to be made again because there wasn't a second earlier. But that's kind of where I'm at as far as responding to the public comment. And I appreciate all the things that people had to say. Oh, I do have one, I'm sorry, regarding crime. I think that crime definitely goes to community impacts. The subcommittee doesn't have public safety as a name in the committee, but I think community impacts definitely includes public safety. And there are things that communities and the DCC can do to help try to mitigate robberies and break-ins and the resulting product that gets put into the illicit market from robbing a legal business. I'm sorry, burglarizing a legal business, because burglaries and robberies are not the same. And you have the problem with the cash. So to the extent that the DCC could support any kind of banking legislation that helps businesses get into banks so that it's a less cash intensive industry, I think that helps support some of the reductions in crime. But there are things that the DCC can do around that window. I think it's an important topic. I just don't know that it rises to the top 5. It would probably be a number 6 for me, but if we want to limit it to 5, I think that's a good number to start with. So thank you.
Thank you very much, Member Woolsey. That's excellent. I would love to hear from the other 2 members of the subcommittee before we start to reconsider the motion on the list of priority items.
Sure, this is Member Bauer. I agree, I think, with your characterization of maybe reordering the priorities or creating some kind of subtopics, but I think I agree with Member Woolsey as well. Those are covered here broadly in our areas of priority, and I think there's lots of discussion, especially around hemp, which we're also concerned with also. And just to put another piece of it, the robberies, the burglaries, obviously banking is a big issue, but also like delivery drivers are also very vulnerable when they're making large deliveries. So markings on packages, what the safety guidelines are. Those are big issues, and you're exactly right. Then those products get into the illicit market, and then it compounds the problem. So just wanted to put a fine point on that. And I think obviously that'll be a discussion maybe under some of this other topics of priority, but I agree that we should probably move forward on this priority listing.
I would echo what's already been said, and I agree with Member Woolsey on the hemp issue, and that does seem to be a little bit out of our purview and maybe a better fit for the larger committee to try to address down the road as DCC is more tasked with regulating that industry as well. I'm supportive of moving forward with the 5 recommendations, and I'm not sure, is my motion still out there, or do I need to make another one?
Why don't we have another one just in case?
So I will make a motion to include as our top priorities addressing high potency products and dosage, warning labels, regulatory enforcement and compliance, and health topics as the priority items. Did I cover all that?
I think lookalike products and was missing. Yeah.
If I can add lookalike products to that as well.
Thank you for that motion. Do we have a second?
I second.
Fantastic. So I think we now move to a vote.
All right, very well. So we are going to be voting on adopting these 5 priorities. I'll go down the list, and if you could, when I mention your name, if you could say present or aye or nay, that would be great. So Member Bauer?
Aye.
Member Woolsey?
Aye.
One second. Member Tupy?
Aye.
And Chair Mathey?
Aye.
All right, it is unanimous. Thank you.
Thank you very much. And I think we still have a motion pending on the table to adopt the overall scope of the committee, the overall purpose statement as well. So I think that motion was made and seconded, but we didn't vote on it.
All right, would you like me to reread that for you?
That would be great.
The goal of the PHCI committee is to provide recommendations to the California Department of Cannabis Control on regulatory and administrative changes to protect the health and well-being of the California population and to reduce the risk of cannabis-related harms, especially among communities who may be disproportionately impacted, such as youth, racial, and ethnic minorities, and low-income populations, and people with mental disorders.
That's great. So
All
I
right,
think we
so
can move forward with a vote on that.
very well. Member Tupy?
Aye.
Member Bauer?
Aye.
Member Woolsey?
Aye.
And Chairperson Mathey?
Aye.
All right, that passes as well. Thank you.
Fantastic. Thank you all. So with that, we will close agenda item number 2. I would like to call for a 10-minute break, after which we will resume with recommendations for future agenda items. Agenda item number 3. So let's return at 10:30. Thank you all. All right, hello everyone. It is 10:30. We are returning from our break. And I would like to recall the meeting to order and resume with agenda item 3, recommendations for future agenda items. So, do we need a roll call?
Yes, please.
We do.
Great. Moderator, if you could proceed with that, that would be great. Thank you.
You bet. Member Tupy?
Present.
Member Bauer? Member Bauer? Okay. Member Woolsey?
Present.
And Chair Maffei.
Present.
We do have a quorum of 3.
Excellent. Thank you very much, moderator. So for agenda item 3, we've covered a lot of ground with our goals, objectives, and priorities for 2023, and we'll be using that information to build future agendas with the department. And so now is our moment amongst our committee members first to discuss whether there are any agenda items that have not been discussed that the members would like to bring up at future meetings. So I think now would be the time to recommend discussion of any one of the particular items that we have identified as priorities so that we can then have a detailed discussion of that topic at a future meeting. And so I would start by saying my recommendations would be to discuss any or all of the priority items that we have now named at a future meeting. Is there anything else that any other members would like to add?
I was just going to add, I guess maybe this is more of a question, but I know there was brief mention related to the health topics about possibly having a speaker or somebody come in to speak to some of those topics. So I don't know how to make that an option based on their availability, but still build the agenda for the next meeting. If that makes sense? Do you know if there are speakers in mind that would be able to present on some of those topics?
Definitely there are speakers, and I can work with DCC to identify relevant speakers and also reach out. We can recruit and receive recommendations. I think that as long as we have identified a topic as a future agenda item, for example, high potency products, if that's identified as a future agenda item, then I think we then have the authority, either myself or DCC staff or others have the authority to then pursue speakers to come join on that topic. DCC, do I have that right?
I think you captured that correctly. So the way that the CAC subcommittees are set up is that the chair works with DCC to craft the meeting agendas. And so I think you've identified a really good list of topics here. And so Dr. Mathey, you could work with us to flesh those out for future agendas.
And that could include speakers if we so choose. Great. Yeah. Thank you. Any other comments from the members on items that you would like to see on future agendas? Okay.
This is Member Woolsey. I agree with that. Any or all of them. I think the 5 topics that we've identified definitely should be discussed in more detail. What, if any, recommendations would come out of those discussions, and then the order in which they are heard or put on future meeting agendas to some extent might be driven by whether or not you can find speakers. I think for me personally, hearing any type of presentation on those topics sooner rather than later would be helpful. But if they're not available sooner, then obviously other agenda items would be appropriate courses of discussion.
Thank you, Member Woolsey. And I would add that in considering which of these priority items makes it to the top of the list and is perhaps the subject for our next meeting. Another consideration that will come into play is decisions that DCC is actively making and kind of which of these topics is kind of most relevant to them in this moment for which our input would be most helpful. So,
I'm nodding, but we'll say yes for the record so that it's
Yes.
recorded. That I agree with that.
Thanks. All right, so hearing, thank you both. So hearing no other comments amongst the committee members for future agenda items, we will now let's hear from the public. Moderator, can you please open the floor for public comment?
Certainly. We are now taking public comment on agenda item number 3 only. If you would like to make a comment on agenda item number 3, please raise your hand by clicking on the hand icon next to your name if you logged into the meeting, or by pressing *3 if you called into the meeting. We are displaying instructions on the screen for your convenience. Please note that for the sake of time, you will have 2 minutes to speak with a 30-second warning. When your time is up, you will be muted and we will move on to the next request for comment. Members of the public will have 1 opportunity to speak on each agenda item. So now let's get started. Attendee Byram, I've sent you a request to unmute. There you go.
Hi, it's me again. If you are going to bring forward this about underage intoxication, and that you bring in a medical person that deals with it, like in San Diego, we have the Children's Hospital that is dealing with a lot of these situations, and that you bring in an expert like that. And also, I'd like to see the underage decoy operations a priority. Thank you.
Thank you, sir. Attendee Armstrong, I'm sending you a request to unmute. There you go.
Can you hear me?
We sure can.
I am Sarah Armstrong. I represent Americans for Safe Access. We're the nation's oldest advocacy organization for medical cannabis patients. I would like to suggest that as you pick up each of these priority items, that you ask the DCC to give you the appropriate law that already exists. And if there is an enforcement component, you ask them to brief you on whether they feel enforcement has taken place or is adequate. The reason for this is there's over 600 single-spaced pages of laws on cannabis at this point, and absolutely nobody can be an expert. But if you get the appropriate law in front of you and can look at it before you take up these items, you will be well enough informed to not waste your time on things that have already been done and are working. I hope that you have every success with these items. They're very important, but if you don't know the existing law, you may waste a lot of your time. Thank you for the opportunity to speak with you today.
Thank you. Attendee Joanna Cedar, sending you a request to unmute. There you go.
Thank you. Can you hear me?
Yes, ma'am.
Great. I'd like you to reevaluate to say that in the wake of AB 45 and the statutorily required but unfortunately poorly produced hemp report, that the department, the CAC, and this subcommittee cannot address intoxicating hemp-derived cannabinoids, poison control recommendations related to IHDCs, and the public education related to IHDCs. Frankly, it's unacceptable and a threat to public health. Thanks.
Thank you. Attendee Sexton, sent you a request to unmute.
Hi, I just wanted to remind the committee of the Center for Medical Cannabis Research at UCSD and the availability of accessing, medical experts on quite a range of topics related to public health and cannabis use.
Okay, thank you. Attendee Kelly McCormick, just sent you a request to unmute.
I'm a parent and a public health educator. And I also would like to encourage a future agenda item on minor decoy operations. I've been involved through my work in minor decoy operations for tobacco retailers, for example. And we always find a shockingly high number of tobacco retailers who sell to minors. And so it's very important to make sure, as we do with alcohol as well, that we are supporting the minor decoy operations to make sure that everyone is following the rules. And I would also actually like to include that on, some of the illegal operators that are still very active in the delivery marketplace. So thank you for your time.
Thank you. And Diana Esmeralda, sent you a request to unmute.
Hi, I'm kind of confused about this committee because it seems that these are already laws and regulations. And if we go to the very beginning of the 600 pages, we see that there is local control over everything. And so when you do make these complaints, as I have to the Department of Cannabis Control, the response is that you have to take it up with your local agency, like your city or your county. And also when we're talking about sting operations for underage selling and this and that, that is also a local community-based control thing. So I'm not sure what the focus of this committee would be, since the laws and regulations are already there for all of the things that have already been brought up in this meeting. That's all. Thank you.
Thank you. Attendee Kathleen Lippett, I've sent you a request to unmute. There you go.
Thank you. I just wanted to remind the committee that many small municipalities and cities do not have the resources to be able to address the situations regarding the associated problems with illegal outlets. And so I think it's important that the funds that you provide, the grants that you provide, also be given to cities who wanted to use their local control. And it's one thing to say that they have local control. It's another to say that they should use that when they don't have the resources to address the issues. Thank you for letting me speak.
Thank you. Madam Chair, I see no further requests for comment. Oh, hold on one moment. We just got here. Attendee Brower, sent you a request to unmute.
Hello, can you hear me?
Yes.
Thank you. Hello, committee. As a parent, I think the greatest threat to public health and safety, and especially youth at this point, are these hemp-derived cannabinoids and intoxicating products that have zero regulation and are everywhere now and widely available on mail order. I'm aware of these hemp-derived cannabinoid beverages and candies just being very easy for young folks to order for home delivery. It just shows up in a FedEx box or UPS box, and there's zero regulation on it. And I think that's where we're seeing a lot of these emergency room visits and a lot of this this harm to youth, and it undermines every single word of the 600 plus pages of statute that's already in place, much of it very thoughtful and having a hard time to implement by the state and the municipalities. But all of those efforts are completely undermined by the unregulated sides of the industry, both the traditional cannabis side that the regulations have had a hard time really capturing and transitioning, but especially the last few years on this hemp derived side. So I encourage prioritizing of that, and whether the committee feels they have authority under their to dive into that or not. It, as a public safety matter, it should be amongst the highest priorities. Thank you.
Thank you. Michaela Sweet, or Sweat, I have just sent you a request to unmute.
Hello, thank you again, and very much appreciate the ability to comment. My name is Michelle Sweat. First, and respectfully, truly, Chairperson Mathey brought up the hemp report, which seemed to imply that the CAC would be reviewing and perhaps relying on the hemp report to guide some of its recommendations. I'm not sure if I misunderstood that or not, but I would like the CAC to include a future agenda item to address the hemp report published by the DCC and to reconsider that it might be within its scope and purview of the Public Health and Safety Committee of the CAC. The hemp report did not meet the requirement of AB 45, and I echo the comments of the previous speakers that public health and safety cannot be fully addressed without an adequate hemp report that outlines, as required, the steps necessary to allow for the incorporation of hemp cannabinoids into the cannabis supply chain, as required by the California legislature that was signed into law by Governor Newsom. A second agenda item might be if, there are a lot of experts on the existing laws and regulations, and you might also have an expert come in to summarize those for you if needed. There are a lot of people, attorneys and others who could do that. And again, thank you very much for allowing public comment. It is greatly appreciated, and we know that you listen.
Thank you. Attendee P. Walker 323, I've just sent you a request to unmute.
Talk. My biggest concern is THC potency, and I would like to see an agenda item whereby we discuss the huge gap between what is considered a standard in Europe. Over there, anything above 10% is considered high THC, whereas here we have concentrates going up to 100%. Why is there that kind of a gap? And how can we address it here? It seems like our most highly unregulated issue is the high potency. And tied into that, somebody mentioned accessing medical experts. I would like to see, an earlier speaker, John, mentioned kids ingesting. I'd like to see somebody from Rady's Children's Hospital in San Diego, where they have declared childhood ingestion a pediatric crisis. I'd like to see that discussed. And also from San Diego ER, Dr. Rani Lev, I'd like to see her discuss the rise in senior admissions, because seniors simply do not understand the interaction of weed and high potency products with prescription drugs, nor do they understand the impact of using marijuana on older bodies. So three things I'd like to see you address. Thank you.
Thank you. Attendee Pamela Epstein, I've just sent you a request to unmute. Attendee Pamela Epstein. just resent the request.
There you go. Can you hear me
There
now?
you go. Yep.
Yes, hello. Thank you again for your attentiveness. I would like to encourage you, as others have said, to reconsider and agendize the intoxicating hemp issue and the hemp report evaluation thereof. To echo others, AB 45 gave a very clear directive as to how to go about doing this, not the challenges to whether or not you should. I think we can look simply at other states. Many other states either start their program by allowing and building that bridge or have gone back to amend it. California, being the largest marketplace in the world, should be doing the same, should be leading versus taking a very retroactive stepping back approach when we know this problem is at our doorstep. We know that it's with children. We know that it's with unsuspecting consumers. We can see that in Los Angeles. We can see that in the clear uptick to poison control and emergency room visits. It's identifying the elephant in the room. We have a responsibility as the regulated industry to protect those who consume cannabinoids. And as the authority, as the adult in the room, we need to understand what is regulated and what is not. And we cannot continue to put our head in the sand and say, but we don't have the authority to act. We actually have the responsibility to act and the ability to ensure that California consumers are not confronted with copycat products, with illicit products that have residual solvents. We have the strongest foundation. We have the best CGMP standards for manufacturing. We have the most stringent testing requirements in the country. I can go onto the department's website, and in recalls, there is only one mandatory recall and 3 voluntary recalls that are cited there. That means that our regulations are working for us in the regulated space.
Madam Chair, I see no further requests for comment. Would you like to close public comment on agenda item number 3?
Yes, thank you very much. Let's close public comment.
The public comment is now closed for agenda item number 3. Thank you.
Thank you very much. And with that, we'll end agenda item number 3. And we will move on to agenda item number 4, which is public comment for items not on the agenda, which is only slightly distinct from the previous agenda item. Okay. And so this is just a public comment session. So I think, moderator, we move straight to public comment again.
All right. We are now taking public comment on agenda item number 4 only. If you would like to make a comment on agenda item number 4, please raise your hand by clicking on the hand icon next to your name if you logged onto the meeting, or by pressing *3 if you called into the meeting. We are displaying instructions on the screen for your convenience if you've logged in. Please note that for the sake of time, you'll have 2 minutes to speak with a 30-second warning. When your time is up, you will be muted, and we will move on to the next request for comment. Members of the public will have one opportunity to speak on this agenda item. All right, and with that, we will get started. Diana Esmeralda, I just sent you a request to unmute.
Hello. Thank you for listening to me, and I'm sorry if I'm fumbling, and I appreciate your attentiveness and how you can answer my questions as best as possible. So I appreciate that during this public comment. I had emailed the Department of Cannabis Control, and they sent me 2 names, Angela Hill for the department, the Director of Governmental Affairs, and the Department of Equity and Inclusion. And then they sent me a link to this meeting, but I don't know if this is the right meeting. In order to reduce the barriers to participating in the cannabis market, there are victims of public corruption like myself and Tim Graston who are facing barriers through public elected officials being bribed and given gifts and things, and so we don't get our licensing, and that's a barrier. especially when we spent $20,000 on a lawyer to send a letter and the city and the city council never even responded. So especially because the 2 out of the 5 people on the cannabis
30
commission
seconds.
for the city of Adelanto have pled guilty and are serving sentences through the federal government. We need to figure out how to rectify that for people like myself who would like to participate in the regulated market. And I would appreciate it if this committee could direct me to which committee I should go to, or to put it on your agenda. I appreciate your time. Thank you.
Thank you.
Just a reminder that our comments, I think for this isn't a period for public comment for items not on the agenda, but they still need to be related in some way to public health and community impact. So thank you for that. Appreciate your comments.
Yes, and with that, I see no further requests for public comment. Would you like me to close public comment on agenda item number 4?
That would be great. Thank you very much.
All right, public comment is now closed for agenda item number 4.
Fantastic. And with that, we have reached the end of our agenda. Members, thank you very much for your time today. I look forward to working with you all in future meetings. And this meeting is now adjourned.
Thank you. Have a good afternoon.
Thank you.
You too. Take care.